Welcome to the Center of Excellence for Behavioral Health and Nursing Facilities podcast, Better Mental Wellbeing. I'm your host, Rukia Campbell. Today, we're very excited to talk with Molly Hedgpeth. She's a nationally recognized leader in long-term care with more than 30 years of experience as a speech-language pathologist, music therapist, and a certified activity director. She's currently a director of dementia and behavioral health services at SLP Operations LLC. And today, she's going to share her experience about bringing substance use support programs into nursing facilities, which is something that's really not often discussed, but is incredibly impactful. So, what initially prompted you to consider implementing substance use recovery meetings into the nursing facility settings that you serve?
Well, we started doing the meetings out of need and out of a response to facility-wide and system-wide awareness that the population of individuals living with substance use disorder is increasing in long-term care.
Mm-hmm.
And watching the Center of Excellence videos and being involved with the Center of Excellence for Behavioral Health and Nursing Facilities, it really prompted the information and the resources that the Center of Excellence provides really prompted, hey, that's a fantastic idea. Let's start that. And Crystal Daniel, who is our regional contact with the Center of Excellence, helped me get in contact with some of the local Narcotics Anonymous and Alcoholics Anonymous accessibility chairs. And from there, we were able to communicate and get them in some meetings and on some teams, and then identify people actually in the communities for our long-term care facilities who were willing to come and be volunteers in our facilities. And from there, we went through the approval process. We enrolled them as volunteers and did everything that we needed from our end. And from there, we started offering these meetings, and it's not just been those meetings, but we've also throughout the whole process identified some other ways to support the residents in our communities living with the effects of substance use disorder. It was really out of
Oh,
need. Mhm.
yeah, that's awesome. So, just, starting those programs have really opened up some opportunities to also have other programs and other ways to support as well. That's good.
Absolutely.
So, how is the Center of Excellence helpful in getting the recovery support meetings actually scheduled and set up?
Well, Crystal, she made sure that I had contacts with the Center of Excellence, and she met with people who were willing to come and volunteer and participate in this with our facilities.
Mhm.
And is she almost kind of screened them for us and made sure that they were people who were willing to come in and understood the population. I think
Mhm.
that, if you look in a meeting that takes place outside of a nursing facility in the community, you don't have the issues that you're going to have in long-term care. You don't have the need for understanding what it's like to have somebody participating that may be in a wheelchair, or
Mhm.
or changes with communication and different things that go along with why they're in long-term care to begin with. And yes, sometimes living with a substance use disorder, sometimes the late effects of that substance use disorder contributed to them needing to move into a long-term care facility. And so they really need a lot of support, because this is a point when the substance use disorder has affected their mobility, their communication, and potentially their psychosocial well-being, because we know a lot of our residents are have lost some family members maybe due to the effects of this disease, and are frequently lonely. So when the Center of Excellence, I think I took one of the online webinars that y'all do
Mhm.
last summer or last spring, and I was like, well, this is fantastic, because you know what, this is a need. This is a need
Mhm.
that, and I've been in long-term care for 25, 30, 40 years, and it is something, there really has always been a stigma, and it's been a population that we've almost ignored in long-term care. We talk a lot about dementia. We talk a lot about strokes and Parkinson's, And we have all sorts of things in place to support those residents. But residents who are living with substance use disorder who move into our facilities, there hasn't been much advocacy for that population. And it's really refreshing to see that the Center of Excellence, that CMS, that we've identified this need and are taking steps to meet that need.
Mhm. That's awesome. So, so once you saw the need, you connected with COE, connected with Crystal. Crystal helped get some meetings set up. Were there any other first steps that you actually had to do as well to kind of get these groups started on the facility side?
Yes, on the facility side, residents have a right to have visitors, but we approached this from a volunteer standpoint because they were going to be meeting with more than one resident. And we went through the volunteer packet and offered them the orientation process.
Mhm.
And to get the meeting started, we coordinated with activities, with social services, with different people who wanted to be involved in the facility. So, in addition to the substance use disorder initiative, we also have done some of the certified behavioral health ambassadors in our program and in our orientation. And these people are really instrumental in not only helping helping the facilities get this going, but not just the meetings, really advocating for those residents because they're aware, decreasing the stigma in the building, and and that's, having the facility support is one of the main things because we don't want our volunteers to just come into the building and not have a group of individuals ready to participate. It takes a whole team to get everybody. We put it on the activity calendar. We've gone through HR with that volunteer process. We've got the residents involved so they know that it's something that's going to be a resource for them. And we will put it on their care plan, and in their nursing facility care plan so that we're also able to demonstrate from a regulatory standpoint that this meeting is not just something we're doing for fun. It's not just something that's a need, but it's part of this resident's plan while they're in our facility. So just a
Mhm.
huge teamwork to get the meetings going.
And for our listeners, when Holly mentioned the Behavioral Health Ambassador Program, she's actually speaking about a program that COE also helps offers. We actually offer a toolkit to help facilities get started with that. But basically, the facility identifies volunteers within the facility to kind of champion the behavioral health tools and resources and sharing those. And like Holly mentioned, they were helpful in her instance in being that kind of boots on the ground support as soon as those that are running the 12-step program are coming in the facility to have a first point of contact with those folks that are familiar with the facility, the residents, and all of that. So that's awesome that you found that to be helpful. So what do you think helps also make the launch successful?
I think other I think following up with the residents has been really successful. Since we first met for this podcast, our we've gotten together and I've formed a committee with other leadership members of our corporation at SLP operations, and we have now a committee that's going to be devoted to updating our policies and our procedures and our activity plans and our training process to support not just the facilities that actually have the 12-step program coming in physically, but exploring other ways that we can support individuals through online meetings. There are some other workbooks and type things, and we've gotten we've collaborated with our behavioral health care providers. So it that's really that's really what we've had to focus on is identifying the residents and then making sure that we're all aware that this is something we're doing together.
So getting everyone on board and
Mhm.
really using it as, like you said, like a group effort. What are some challenges, if you had any, and how did you overcome those challenges with getting all this set up?
Well, one challenge is like I said, having a group come to the building and nobody being there, or having an eager volunteer and no facility participation. So that was one of the first challenges. Another challenge has been the lack of volunteers and people who are willing to come into the facilities. They're there, but identifying who that is, it was a challenge. And Crystal with the Center of Excellence really helped us overcome that. Another challenge we have is that while we want to support this recovery culture, a lot of our residents who are in need are actually still engaging in active use
Mm,
and and still will check out of the facilities and go make attempts to obtain alcohol and other substances and
mhm.
then try to bring them back into the facility. So it's been challenging to navigate. Hi, we're supporting recovery, but this is not something that we can have in our facility because this puts us at a regulatory risk. And
Right.
and so part of our new committee is focusing on identifying, how we're going to decrease the risk for us as a facility as well, but still support the resident. And that's a massive challenge when you have people who were really trying to support. Um, we had one resident who was engaged in active use, and she had a visitor bringing substances into the facility. And unfortunately, for the first time we offered her an opportunity to seek professional help and move into rehab, she said no. And her her visitor that was coming to the facility was supporting her choice, and she
Mhm.
just still was obtaining these substances. But through a lot of training and communicating with the facility, using the language matters tool to decrease the
Mhm.
stigma and let them know that, hey, this is a real disease. Just the education on how challenging substance use can be to overcome.
Mhm.
We continue to offer her that support, and she did actually make that choice to go ahead and check into a rehabilitation facility and
Mhm.
and sought medical help, and she's still there. And I have the highest hopes for this individual, and I hope the best for her. And I hope that she comes back to our facility and can help support our initiative. And even as a resident, maybe she could be somebody who wants to lead her own group in the
Right.
facility, and
Right.
that would give her meaning and that would help support her as well as other residents.
Yeah. Yeah. As with any program, I know that, it's especially with launching something new, folks are going to experience challenges, but it's encouraging to hear that you've been able to find different ways to try to address those challenges and work through them. So, on the contrast of that, are there any success stories that you have to share?
Well, yes, other than her, we have a group, we have a facility in one of the communities in our state that has the highest use of methamphetamine, one of the highest uses in the country.
Mm,
And our residents in this facility have really, uh, our population there is big. It's part of the culture in the community, and it's almost was a part of the culture, the substance use culture in the facility. And it was identified that we needed that there, but approaching that from a different standpoint of, hey, let's support recovery instead of they're the bad people.
mm,
um, we were able to, that community has an amazing group of volunteers that come in. They come in weekly, and they have a full-on Narcotics Anonymous meeting in the facility, and it supports the residents' right to do that. But we have more and more people coming every week, and at least six of our residents in that community have listened to the message of hope provided by the Narcotics Anonymous group, and have said, come out and said, hi, I have a problem with this. And they're actually working the 12 steps,
mhm,
and they're doing that in the community. And not just Narcotics Anonymous, but a couple of them also came out and said, hey, well, I'm an alcoholic. And so instead of just being a Narcotics Anonymous classic group, our volunteers have had to modify and said, yes, everybody can come in here. And we've even had a couple individuals who wanted to just come to the meeting and listen. And they opened up and talked about how the substance use disorder affected their family and their children. And so it's just such a lively variety of people with all these different experiences coming together in that group. And I get feedback from the volunteers, they're not going to share everything because it's an anonymous group, right?
Right.
But
Right.
it's been really special for those residents to have that, and to have that. It's like something they can hold on to that gives them purpose. In long-term care, we talk a lot about how they've lost so much. And this has been something not just to support their recovery, but something from a holistic standpoint that they've gained in the facility. And I get a lot of feedback from the volunteers about how it's just so meaningful for them. It's not like other meetings that they facilitate. They feel like it's a mission because it is a very special population in long-term care and nursing facilities that we deal with. And it's just been amazing. And I'm so happy that we can offer that. We worked with another group, and she predominantly does the online meetings. She has an Alcoholics Anonymous meeting that, oh, they have a fun name. I'm not going to say what their name is, but they have a really fun name, and they meet every morning at 8. And we have 3 residents in this facility that are regularly attending. It's a different facility, and they log in on a computer, on a laptop every morning at 8 with one of our facility volunteers, our ambassadors, and they attend this meeting. And that's also been really important for them. And they like to do it in private. And so now we've got it where they're not in the cafeteria anymore. It started out, oh, it's going to the cafeteria. Now they actually have a designated space for their meeting where they can go in and do that. And not just limited to the 12-step program, but we did have a resident who needed support that was not somebody who believed in a higher power, which is a core element of the 12-step program. And we were able to find some materials from a group called the Smart Recovery. And it's a recovery program that they have workbooks and different things online that we've provided to him. And he's not really actively seeking recovery right now, but to have that ready for him if he ever wants to do it is something that we want to offer to everyone.
So just being prepared and meeting people where they are to be able to provide support and service is important. So as we look to wrap up our conversation, what would you like our listeners to remember about our conversation?
I would like our listeners to remember that all of our long-term care facilities in the country are seeing more and more of this in long-term care. And it's not something that's going to go away, but we need to decrease the stigma immediately so that we can truly support the individuals who move into our facilities with substance use disorder, with potential comorbidities of mental illness, and get rid of the stigma so we can support them, and that there are ways to support them that can also support your regulatory outcomes for your facility. But there's help.
Yeah, that's awesome. Well, thank you so much for your time today, Molly. It's so appreciated. It's been a pleasure talking with you. And thanks for just sharing your experience and how you've all been able to, support your residents with substance use challenges.
Thank you so much. Have a great day.
Thank you. And thank you all for listening and watching our Center of Excellence for Behavioral Health and Nursing Facilities podcast, Better Mental Wellbeing.